Okay, listen up. Stem cells can trigger the healing process for arthritis and many other things. From Wellness by Design, we have Dr. Connie Casebolt Carver. Good morning, Doc.
Good morning.
How are you? So you're just making people new again.
Try to.
You really are. And you got some elderly people getting
We do.
injections?
The last few that I've done have all been 78 or older.
Right.
And you know, age takes its toll. One of the things that happens as we age is we're still producing some stem cells, but they become fewer and fewer and less active.
Kind of like hormones with age.
Kind of like hormones,
Well,
I know. Everything kind of goes south as we get older. So we end up to the point where the ability to repair cannot keep pace with the degeneration.
Yeah.
So that's why we call stem cells a regeneration strategy or approach, because we're actually injecting a substance into, for example, a knee joint. We're injecting a substance into a joint that is then triggering the healing response that we used to have when we were younger.
Right.
So babies are born with just tremendous numbers of stem
There's your
cells.
picture.
And so again, we can inject into a joint something that will trigger, and you can go from arthritis and pain, like you see on the screen, to a fully functional joint that has no pain. That individual can hike now and just has a better life.
Now, where are you getting the stem cells?
So good question. We're purchasing them from it's actually the Utah Cord Bank.
Yep.
And the stem cells are derived from what we call perinatal. That means products at birth. So healthy women who are going to go a planned C-section, this cord bank is harvesting from amniotic fluid, placenta, umbilical cord. So no babies are harmed.
Yeah.
So there's no ethical issues.
But that's the best, right?
Yeah,
Umbilical
exactly.
cord?
Yeah, well, actually getting them from all of it is the best. So
Okay.
the stem cells come accompanied by, we call it a soup of messenger RNA and exosomes and different things, all of which stimulate this tremendous healing response. So, and actually once we put the injection in there, it continues to work for 3 months.
That is amazing. This
great.
is something like when I first had William, he's 10.
Yeah.
They, when it was going to be, no, actually it was like when Griffin, because we knew it was going to be Plan
Yeah.
C. And they asked, it was like, do you want to, and it was still so new.
Right.
That I was like, is this one of those like scams
Yeah,
where they,
yeah.
you know what I mean? You pay all this money and it's like, oh my gosh, like I
Yeah.
wish like we
Yeah.
would have known 6 years ago.
You don't match stem cells with the person getting the injection like you do blood types,
You actually
right?
don't
It's not
have
like blood
to.
types?
No.
Okay.
The cells are so immature, they have not developed the ability to react to a host. So we've had no reactions.
Yeah.
Yeah, it doesn't work that way. So, but we can, not only joints, but we can inject it into other tissues. So for example, we've had quite a good success. Women who have incontinence, they have those embarrassing leaks, and the injection of stem cells into this one particular area plumps up the tissue and prevents that leakage from happening.
In the
so
pelvic area.
a lot of happy women too.
Yeah.
I bet. I mean,
I guess
again,
so.
another fun consequence after you have birth that could happen. That's
Now we
crazy.
can come to your seminar next Tuesday.
Absolutely. Next Tuesday, I'll give a more full explanation of everything about the procedure, questions and answers. There'll be Q&A, so we'll be happy to answer questions about anything to do with stem cells. We have some other regenerative procedures there, so we also offer ozone injections and all kinds of things that help people feel better and kind of reverse that aging process.
I know one question people always ask before you leave is, what about insurance? Does
Yes.
that cover?
So yeah, that's a very good question, because insurance will only cover things that are considered mainstream and conventional. This is still considered experimental.
Right.
But the good news is, even if you pay out of pocket for this, your costs are going to be less than if you go through a knee replacement surgery,
And
which
pay a
can
copay.
approach. That's right. That can approach $60,000, and then you think of the downtime. There's a 3-month recovery period. You've got a big scar. You've got pain. You can never bend your knee again like
It's
before.
not the same.
And with this injection, no downtime, very little pain, and very effective.
All right, let's tell them where you're located, because it is next Tuesday at 6 o'clock.
Yeah, 850 South Pleasantburg, just about a block from Cleveland Street. And what's nice, the property next door, I think, is being sold, so they've cleared off all these trees, so we're much more visible now.
Now you can see
Yeah.
it. Yeah.
So it looks a lot more cleaned up because the property next door kind of did a little haircut on their shrubs.
Yeah.
But yeah, 850 South Pleasantburg. You got to call first so that we can plan on how many people are coming.
Thank you, Dr.
Thank
Connie.
you.
We
Thank
appreciate
you.
it.